Did you know that you can cause damage by brushing your teeth? I'm a dental hygiene student at Northampton Community College. We have been taught the correct methods so we can educate our patients. There are many techniques, some are effective, some are not, and some can actually cause more damage than anything. Learning the correct way can save you pain and problems later on down the road. Many of us were shown how to brush our teeth as children, but some of us were never taught the transition into adolescence and adulthood and how to brush our teeth correctly. First, let me start by telling you the correct way to brush a child's teeth. Parents should start brushing their children's teeth as soon as the first tooth erupts. This can be done with a washcloth or a finger brush. No toothpaste is needed. As they grow into toddlers, start using a child's toothbrush with children's toothpaste, which is fluoride-free, until they're age 4. Then you can start using fluoridated toothpaste. Brush using a circular stroke for 2 minutes, 2 times a day. This is called the Phones method. Use this method on the outside of the teeth, along with the inside, and you do a vertical stroke on the insides of the front teeth. The biting surface just gets a back and forth motion to remove all the debris and plaque. As children acquire the dexterity they need, they should brush their teeth first. Parents should then follow up afterwards to ensure that they did a good job. Make sure you floss your teeth once a day also. Now that you know the method for children to brush their teeth, let me explain how to brush after age 10. By the time a child is 11, they should be using the rolling stroke. The rolling stroke, you begin at the gum line, and it's just a gentle sweeping motion. You do this about 10 times per area, and then move along, totaling 2 minutes for the whole mouth. And again, the vertical stroke on the insides of the front teeth, and the back and forth motion on the biting surfaces. This method is more effective at removing plaque from teeth, and by age 11, the children should have the dexterity that it requires. Also, remember to floss once a day. Allow me to move on to the method most adults use. Some adults still do continue to use the rolling stroke, although the modified BASS is a much better option. Start by placing the bristles at a 45-degree angle at the gum line. You're going to vibrate the brush back and forth without actually moving it. You're just vibrating the bristles for a count of 3 to 4 seconds, and then finish with the rolling stroke. And you'll do this for every surface for a total of 2 minutes, 2 times a day. Again, also flossing once a day. It is important as you become an adult to be sure to switch from the Phones method or the scrub method, as some people use. They think they're getting their teeth really clean by scrubbing really hard throughout the whole mouth and just doing it really quick. But in fact, all you're doing is causing recession. Recession is when your gum recedes from along the tooth. It exposes a layer called dentin, which is very sensitive. You now see why it is important for people to be informed of the correct way to brush their teeth. To summarize, teeth should be brushed using the Phones method as a child, then once you're 11, the rolling stroke method should be used. Ideally, into our late teens, you can use the rolling stroke method, but then once you hit adulthood, modified BASS method should be used. If you would like more information on the modified BASS brushing method, you can visit www.ncbi.nlm.nih.gov. You can also visit Colgate's website, colgate.com, for more information on all the different techniques. After this, I hope you thought about the method that you use, and next time you go see your dentist, you ask your hygienist about which method is right for you.